Hello everyone and welcome back to MiraAnaT. Today we are going to discuss how the heart is looking like in the normal chest x-ray. What is the features, what are the items and the points we should look at. Okay, first of all, we all know that the heart is located in the middle mediastinum, and obviously it will be located in the middle of the chest x-ray. And since we are commenting on the features of the heart, in a chest x-ray, so it has to be posterior anterior view. Okay, let us start with the one which is annotated or labeled. So now when we are looking at the heart, now let us start with the very right side border, which is like making a little convex bulge, this part, which is denoting the right border of the heart, and this is radiologically, and it is equivalent to the right atrium. So it is located to the right side of midline and it is a little bit convex. Now this right border, which is made by the right atrium, if we go upward with it little bit, it will lead us obviously to the superior vena cava shadow. So this little very small shadow is the superior vena cava. If we went little down near the junction of this right atrium with the diaphragm, or the part that is like between the right atrium and the diaphragm, will lead us to the inferior vena cava. So this part, it will be the inferior vena cava piercing the diaphragm from abdomen going inside the right atrium. So this is on the right side. So we have, again, let us revise. We have right border of the heart, which is equivalent to the right atrium. Its upward extension it is a superior vena cava. Its downward extension nearby the diaphragm, this is the right copula of the diaphragm, is called inferior vena cava. Moving to the other side, which is the left side of the heart shadow, we will find ultimately a bigger border which is more or less sloping downward. This is the left border of the heart, which is made mainly by left ventricle. At its end of this left ventricle or left border, this area is called the apex of the heart, which is usually in normal cases formed by the left ventricle radiologically. Now, the meeting of that left ventricle with the left copula of the diaphragm, this is the left copula of the diaphragm. This meeting point in the normal chest x-ray, when you are commenting on the heart, it is obtuse angle. This is normal. If we find it out in certain cases, like we are going to explain later on, acute or right angle, that's mean there is abnormality in the heart and there is right ventricular enlargement, which is like affecting this obtuse angle to convert it into right and or acute angle. So this angle is called left cardiophrenic angle, which is between the left border of the heart, mainly made by the left ventricle with the left copula of the diaphragm, and it is normally obtuse. Going upward with this left border of the heart, which is made by left ventricle, usually we can demonstrate two little bulges. Okay, the first upward bulge, which is like, if you see it, you will find it in the first left intercostal space. This is called aortic knuckle, and the aortic knuckle actually is a radiological terminology referring to the end of aortic arch before being descending aorta. So now how to know that this is aortic knuckle? Again, look to the ribs. This is our clavicle. So this is, we are going to count the ribs, the anterior ends from the periphery, then downward and medially. So this is the first rib. This is the second rib. So the distance between the first rib and second rib, it is intercostal space number 1. And we are on the left side. So now this is the aortic knuckle. If we looked at the shadow just below this aortic knuckle, this is called pulmonary shadow, which is made by the pulmonary artery. It is located in the following space. Where is the following space? This is the third rib. So here we have, this is the first intercostal space occupied by aortic knuckle, which is the end of the arch aorta, followed by in the second space the shadow for pulmonary artery, main pulmonary artery. And if you try to correlate, you will find yourself putting your stethoscope on the second left intercostal space to comment on the pulmonary component of the second heart sound. Okay, why? Because you are nearby the pulmonary vessels and the pulmonary valve. Okay, so the pulmonary artery, the main one, is located in the second left intercostal space. So this is the normal features in the during or while you are commenting or checking or examining an X-ray. Normally, how the heart should be looking like with its components, which is right border, left border, the continuation of right border upward or downward, or even the aortic knuckle and pulmonary artery. Then this is the left ventricle, left copula, and so on. Okay, so let us apply whatever we have in the second photo, which is beside it. Okay, in the second photo, it is normal chest X-ray, although like it is little bit different. But let us see something which is like very apparent here in front of us, which is a trachea. Trachea here in the second photo actually is very apparent. Okay, if I wanted to trace the trachea, it is here nearly in the midline with a little bit shift to the right, as you see, and this is normal. Okay, and at the level of T4, the trachea start to divide into right main bronchus, this one, and left main bronchus, this one. Okay, in some chest X-ray, while you are commenting on the heart, the aortic knuckle is not bulging like that it is not obvious. It is normal case, normal patient, but the knuckle is not obvious. So if it is not obvious, how I can find it or how I can track it? Usually it will be located above the left main bronchus. So since here the trachea with the bronchi are prominent, so I can with confidence tell that the aortic knuckle in that patient is at bulge. Okay, if I wanted to confirm my suggestion, okay, or my assumption, let us again look to the ribs. Since we are commenting on the heart, it has to be posterior anterior chest X-ray. Okay, so this is the first rib, since this is the clavicle, as obvious. Then this is the second rib. So now really we are in the left intercostal space. So this is definitely aortic knuckle. So now aortic knuckle, either you know it by spaces if the ribs are very clear and obvious and you can count, because sometimes the exposure of the X-ray or the dose of radiation doesn't allow you sometimes to really with clearance to count the ribs. So just in case the ribs counting is not helping out, so you can rely on, if the trachea and the bronchi are obvious, so you can rely on the presence of aortic knuckle just above the left main bronchus. And as I told, aortic knuckle here means the end of aortic arch before getting or converting into descending aorta. So now this is aortic knuckle. If we wanted to tell pulmonary artery, where is the pulmonary artery here? Definitely will be the bulge below. Because at that time again, it will be located in the second left intercostal space. This is the third rib, second, and this is the first. So this will be pulmonary artery, the main one. Okay, going with the left border of the heart, which is made by left ventricle. This is the left border of the heart. This tip is the apex. The conjunction of the left border of the heart with the apex, because this is assumingly normal X-ray, with the left copula of the diaphragm, this will give you obtuse angle again, as long as the angle is obtuse. So that means the apex of the heart is the dominant chamber constituting the apex of the heart clinically is left ventricle, and this is normal. Okay, why? Because when we compare it later on, for example, with phallotetralogy, will not be the case, and the apex will be totally different in shape. Moving and shifting to the right side. Again, I'm going to jump to the most convex part, to the right side of the midline below the bronchi. This will be the right border of the heart, which is the right atrium. Its lower part near the diaphragm, this is inferior vena cava. So this is inferior vena cava ultimately. Okay, and if we went superiorly, this will be superior vena cava. Okay, thank you very much.